It seems that these days, a certain group of Americans have all been lumped together into an overarching category, a group simply referred to as the uninsured. But there's a fatal flaw in the classification of this hardworking group. They're not a group at all. Each of the nearly 47 million Americans who are under or uninsured is just that, an individual with singular needs. That's why Johnson & Johnson Healthcare Systems created Access to Wellness, consolidating a multitude of assistance programs to provide a single point of access, a single resource, a single route to the broadest selection of free and discounted medications, over 1,000 in all, to meet the singular needs of under and uninsured individuals. After performing extensive research, we uncovered a key consumer insight, one that would guide us at every turn. Uninsured people don't identify themselves as a group either, but as individuals, something no photograph in the research could accomplish. So we produced a creative, easy-to-identify-with series of illustrations that represent us all. But it takes more than a good idea to craft a successful service. We developed an array of materials, each produced with our key consumer insight in mind. There's a website featuring innovative eligibility tools and an online application. We also provide a bilingual call center. In addition, we developed materials that our sales associates can use themselves, and others they can pass on to healthcare professionals to meet their needs, as well as materials that speak specifically to the patient. The response has been remarkable. As an OPCO representative put it, practices and hospitals now view me as more of an office resource than just a sales rep. In fact, 93% of our field associates are now aware of Access to Wellness, and 81% have already discussed it in depth with healthcare professionals. Another rep said, "More and more offices are begging me for additional samples, and Access to Wellness allows them to help many more patients." And another associate said, "Access to Wellness helped me demonstrate J&J's commitment to the patient and has given me more time to spend with healthcare professionals." Those healthcare professionals are just as impressed. 73% of patients contacting the bilingual call center were referred by physicians, and overall, physicians gave the service a rating of 8.1 out of 10. And the patients themselves? Our key consumer insight seems to have been right on target. 86% will now recommend the service to others, and 79% said Access to Wellness is a true public service. Access to Wellness delivers on the credo, delivering to our customers, their patients, and our employees. In fact, once patients heard about Access to Wellness, those who said their perception of J&J was very favorable rose from an already exceptional 64% to an astonishing 76%. In other words, Access to Wellness not only puts a smile on their faces, it even brightens the face of J&J.